Patients typically present often with pain, but sometimes just dysfunction or weakness. We typically present and assess the patient in the office, their complaints and their dysfunctions. Often involves imaging, either x-rays or ultrasounds or an MRI. Again, most patients do well with non-operative treatment, so we often undertake physical therapy, activity modification, home exercise program either through the physical therapist or the certified athletic trainers in our office, cortisone shots. If patients elect to proceed with surgical treatment, they're evaluated often by their own primary care doctor to ascertain their fitness for surgery. They're typically evaluated by the pre-admission testing within the week of surgery. And then typically for my patients, it's outpatient surgery, which is in and out in the same day. They go home and rest. We provide them with multimodal pain management, ice therapy, allow the shoulder to heal for a few weeks, and then typically start physical therapy depending on the procedure that they undertook. They undertake physical therapy for weeks, but typically by 2 to 3 months, and certainly by 6 months, are much better than they were before the surgery and are ready to achieve the goals that they had set out for prior to the surgical treatment. The lion's share of the procedures that I undertake in the shoulder are outpatient, meaning the patient comes into the hospital, has anesthesia, the surgical treatment, recovers, and leaves in the same day. Some patients with significant fractures or joint replacement will stay overnight. The shoulder is non-weight bearing and you can walk the day of or the day after surgery, so the need to stay in the hospital for long periods of time is significantly diminished, especially compared to 10 years ago. And most of the patients will be gone back to their home and very rarely to rehab on the first, second, or third post-operative day. Very rarely do patients stay in the hospital longer than 2 or 3 days.